The last area that I'm going to talk about, and I'm sorry if I'm losing you on my whirlwind tour through 2012, talks about chemotherapy and a concept called maintenance. So we have learned that after a person has their first type of chemotherapy for lung cancer, most commonly with cis or carboplatin, that we have options. Classically, we give 4 to 6 rounds of chemotherapy, and at that point, we believe that that first round of chemotherapy has really done the most benefit and really given us the most shrinkage and disease control that we can get. In the old days, people then used to have the option of taking a break, going on holiday, getting some chemo relief. But we did learn that in some people, and it's always worth discussing with your doctor whether it's reasonable to have a treatment break or whether it's reasonable to switch treatments. So this was something called switch maintenance, where people who didn't have Pemetrexed or Alimta before could switch to it, and they had longer survival rates, which is really impressive. And people with squamous cell cancer for whom Pemetrexed or Alimta doesn't work very well, erlotinib or Tarceva is an option, or for those people who have an EGFR mutation but got chemotherapy first, or people who didn't want to have more IV chemotherapy but where a person and their doctor felt that a treatment break was not a good or a safe idea. This year, given that so many people are getting Alimta or Pemetrexed at the beginning or with their platinum in the first-line setting, the study that was conducted by Eli Lilly, which makes Pemetrexed, was reported this year where people got Pemetrexed and platinum, and they then either continued on Pemetrexed or Alimta alone, and many people do this already, or they received a placebo. And what this study showed was that here in yellow, people who stayed on the Alimta and stopped the platinum did have better survival than if we just stopped the chemotherapy altogether. But again, it's modest. And so clearly, these people in here, the difference between these two lines, these are the people who benefit. There are obviously a lot of people in here who can still take a break. And so it is worth a good discussion with your doctor to see whether or not maintenance Pemetrexed or Alimta is for you or what your other options are. And so what this study has really allowed us to do is for those people who had Pemetrexed or Alimta at the beginning, we don't have to switch. We can just keep going. So it's an expansion of what we can currently do as maintenance.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts and the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support.